Hi everybody and welcome to Optometry TV. I'm Kara Moore. I am joined now by Tracy Doll, who is here to talk about some cosmetic myths and ocular disease, and specifically some of these beauty trends that we're seeing a lot more of right now, like lash enhancements.
Absolutely. I don't think you can go anywhere right now that offers any sort of beauty regimen without seeing this emphasis on the elongation and the enhancement of eyelashes. It's in our drugstores. They're popping up in our neighborhoods, these small beauty salons that are offering services to help to boost bigger and more open-looking eyes.
Right, and I'm sure practitioners know all too well of the popularity of these places right now.
They do.
Right?
When you see those behind your large microscopes, it's pretty obvious when patients have had these enhancements done. But they're not always as safe, and I think there's some things that we can do better as the industry to help to educate our patients about what it is that they're really getting themselves into.
So what do practitioners need to know about trends like that?
First of all, a lot of these beauty enhancements that are done in a beauty salon are going to be done by licensed practitioners or unlicensed. It's very important to educate your patients if they're going to do this, that they need to be asking the right questions about who they're seeing to do these particular procedures. Those people that are doing these procedures are using very sharp, small instrumentation, not unlike what we use in the medical practice. And if they're going to be doing that, they need to be going to someone who's licensed and has a lot of experience. So when patients are going into these beauty locations, they need to be asking for references. They need to be asking to watch the procedure itself. They need to be asking how they disinfect and clean their equipment, because they are using sharp instrumentation near the eye.
How big of a problem are things like that for practitioners who are trying to make somebody better, a patient better, and yet, you know, they're doing things that may be harming themselves?
It's not standardized the way that their patients are told to care for these enhancements or extensions. So a lot of times patients are told, in fact, not even to clean them or wash them in order to keep them on longer. The typical lifespan of eyelash enhancements is only 2 weeks and recommended to refill 2 weeks later. So oftentimes they're told not even to clean the eyelashes, which then can come with complications of contracting blepharitis, blepharoconjunctivitis. Allergic reactions to the glues are very common. There's a lot of preservatives and even formaldehyde in the glues, which are highly allergenic. So patients are coming in from these beauty salons irritated, injured, and it's up to us to be able to fix that and to help the patient know what to do better next time.
And what should the patient do? I mean, what should practitioners tell these patients? Just steer clear altogether, or what?
Well, we don't have to take away everybody's fun. Using eyelash enhancements, for going to a wedding or going on vacation for a short amount of time, that's okay. But this should not be something that patients are doing day in and day out and day in and day out. And there are healthier swaps that can be done to help the patient feel beautiful, look beautiful, but not encounter those risks that come along with the enhancements.
And how much of a challenge is this for practitioners who maybe, we're not even talking about lash enhancements anymore, just makeup that might be dangerous, that there has to be some kind of communication going on, right, between the practitioner and the patient about, say, the makeup that the patient's using?
A lot of practitioners don't even really know a lot about the cosmetic industry or what's actually in the makeup themselves. So if they're not educated, they can't educate their patients as to what the healthier options are. There are definite better alternatives, things with fewer preservatives. You have to turn the product over quicker, but it's definitely healthier on the eyes. Simple swap outs like going from waterproof mascara to non-waterproof can really improve the patient's irritation level.
And practitioners should keep those things in mind?
Should keep those things in mind when they're looking at the patients and not be afraid to have that conversation. We've all seen the patients with the spider lashes. It's not necessarily always necessary having that conversation about how that may be detrimental to their ocular surface, and then giving them an alternative is better than just taking something away. I mean, you and I both know if somebody told us that we couldn't wear makeup tomorrow, we're not going to go along with that. We're going to be using our beauty products. It's just about choosing healthier options.
Okay, well, very good. Tracy, I appreciate you being with us. Thank you so much, and thank you all for watching Optometry TV.